Hello, everybody. Welcome to this special live stream. My name is Emmanuel. Please, if you can, let me know if you can hear me. I'd be very grateful so that we can start on the same footing. So I'm just checking the comments. Please let me know if you can hear me. Um, I can see a few people. I can see Kudzimbizi. I can see Prudence. I can see you, Mr. K. Mr. K is there. Mr. Dennis Joao. Thank you so much. Oh, Pastor MacD. I can see you guys. Everyone can hear me. That's great. My name is Emmanuel. I'm from Milton Keynes Assembly. I think most of you will probably know it as Ebenezer Fellowship. I'm the youth leader, and I am in charge of the Greats, which is the name of our youth group. I'm sure all the greats are in there. I can see you, Tatenda. I can see you, Lina. I can see everybody else who's coming in, which is great. Thank you so much once again for joining us. I know that a lot of my face might be new to some people, but I'm sure other people who are joining are probably seeing me. They're probably sick of my face, seeing me all the time. So what we've done in Milton Keynes is as a youth group, we really wanted to try, and obviously it's a difficult time, and we wanted to tackle all the issues that are really coming in with the pandemic. So we came up with a project that we've titled the MK Phoenix Project. Our motto is that still we rise. Out of all the troubles that we're having in the pandemic, out of all the challenges, out of everything that is happening right now in our community, still we rise, because we have to rise above each and every single struggle that we all have. And I'm so glad that right across the nation, a lot of people have got projects going on, and we are all being active in the community, and we're supporting each other. And I do press that, you as a person, please do try your absolute best to make sure that you are supporting your community, you are supporting your family, everybody who's in need. Everybody has a need at this minute. So people struggle. Just make sure that you let them know how they can best handle the pandemic. So what we've done today is that we've come up with a topic that we really wanted to discuss, and really from a young person's point of view. Obviously, we know that our Prime Minister is always giving us daily updates in terms of what's going on with the pandemic. Our Chief Doctor is always telling us, but we really wanted some people and some professionals to come in and maybe speak to us maybe on our level as young people, as parents, and as whoever else is there, and to just help us maybe understand a little bit more about COVID-19, to help us understand what we can do to fight a good fight against COVID-19. How can we protect ourselves? How can we protect others? So this is something that I'm hoping we can all participate with. We've got a Q&A section. I know some questions have already come in, and in the comments there, whether you're on YouTube or whether you're on Facebook, please, by all means, just make sure you pop your question if you don't understand what's going on. So without further ado, I'm gonna bring in Proud, who is a doctor. Hello, Proud. Can you hear? Can you
Hello,
hear us?
Emmanuel. I can hear
Yeah.
you.
So this is Proud. He's one of my oldest friends. I think we've been friends for. I've known Proud since we were in high school, and Proud is now a doctor. I shouldn't say Proud. I should say a doctor. But we've got Proud here, who's gonna take over the session and carry everybody through. And hopefully, by the end of this session, we'll all know a great deal. We'll all have discussed everything that we need to discuss. So Proud, without further ado, man, let me not take your time. Please, by all means, take over.
Thank you very much, Emmanuel. I'd like to thank you and your team, the MK Phoenix project that you've launched. I know you're doing great things in the community. I'd like to welcome and thank Pastor Danny Manyanga, who leads the Ebenezer Fellowship Church, and he is the main pioneer and the leading head at the Ebenezer Fellowship. I would like to thank the team for allowing me this opportunity to come and speak to you. We're going to try and speak about all things COVID. Okay, maybe not all things, just as much as we can talk about in an hour, okay? There is a lot to cover, but I will try and just focus on the main things. And to do that with me, I would like you to help me welcome Dr. Rutendo Ganyani. Hello, Rutendo, how are you?
Hi, Kuda. Thank you so much for having me. Can you
Thank
hear
you
me?
very much for joining me. Yes, I can hear you. I can hear you. So, Rutendo, before we start, can we just, I guess, start by introducing ourselves? So can you just tell our audience who you are and where you work and what it is that you do?
Okay. So my name is Rutendo Ganyani. I am a medical doctor. I graduated about 3.5 years ago from Warwick University. I work mainly within Coventry and Warwickshire at the moment. I'm hospital-based. I'm an SHO, which means I'm a senior house officer. I work on general medical wards mainly, but at the moment I'm mainly within geriatrics, which is care of the elderly patient. Yeah, that's what I do.
Lovely. Thank you very much for joining me today. Now, I'm Kuda Proud Mawando. I'm a registrar in intensive care and anesthetics. So that means I mainly work in the intensive care unit where you've got the sickest patients in the hospital, essentially. And most of them are on organ support. So that's where some of our COVID patients have ended up. And I've had the pleasure of looking after some of them. I've been doing this for 3-4 years now, and the pandemic has been quite eye-opening and enlightening. We've had a lot to learn, and so we're going to try and share just what we can, as well as answer some of your questions. We've had some questions come through, and we'll try and just do that as swiftly as we can. So, Rutendo, would you like to kick us off by just telling us what exactly is COVID?
Okay, so I'm sure a lot of you already know a lot about coronavirus, and a large part of this talk will be covering those things, perhaps in just a little bit more detail, and then going into hopefully things that you haven't heard of before. But COVID is a virus. It's part of a group of viruses that has already been known in humans for a long time. It's part of the family of coronaviruses. But what makes it different is that it's a virus that we hadn't seen before, hence why it's been newly named as COVID-19. Coronaviruses normally come from sort of animal hosts and sort of transmit into humans. And this is the first time that we've seen this particular virus being transmitted from whatever reservoir it was in into humankind. Yeah, that's what COVID is.
Lovely.
So perhaps give us a little bit more information. I'm sure you're going to cover this anyway, Prad.
Yes.
The main effect of coronavirus is an infection within the respiratory system. But from patients that we've seen, it does have far wider ranging effects than just the respiratory system. But I'll let you cover that.
Lovely. Now, we're going to try and talk about what you need to know about what COVID is, and then we'll touch a bit about vaccines, okay? And then Rutendo will tell us a bit about what we need to do if we get coronavirus, and then we'll answer the questions at the end. Now, as Rutendo rightfully said, coronavirus, it's in a group of viruses that mainly affect the respiratory tract, and that can be your nose, your sinuses, your throat, and we found that this particular virus also can cause some infections in the lower respiratory tract, which is your lungs. And a lot of patients end up needing ventilators for breathing because their lungs get stiff and they can't breathe as well for themselves. Now, it presents in a various of ways. So initially, in the first say 1 to 5 days, you don't normally get any symptoms with coronavirus. Now, this is because the virus itself is dividing in the body, and in this period, you don't get the body is not trying to fight anything, so you don't show any symptoms. After about 5 days, right up to about 11 days, you then find you get this fever, feeling tired, cough, headaches, and it can also present as diarrhea or loss of taste or smell, which is something we learned a bit later on. After about two weeks time, you then start getting the hypoxia, which is where your body is starved of oxygen. And that's just because your lungs can't quite make use of the oxygen that you're breathing in as well as your body needs. Now, from this, we've learned that we can treat it in various ways. And I'm not going to focus too much into that. I'm going to focus into what we can do in those first sort of couple of weeks. So in those first, say, 5 days, whilst the virus is dividing, and maybe even before you even catch the virus, I think I will hand over to Rutendo to just tell us what is it that we can do on a day-to-day basis to try and prevent this virus, because as we know, prevention is better than cure. Isn't that right, Rutendo?
Definitely. I'll just share my screen with you. Just bear with me a second, guys, and we'll go through what we can do to prevent COVID. Can you see my screen okay?
Yes, we can.
Okay, so first things first, we've heard a lot of things from the government about hand space, space, and all of these things. So I'm just going to reiterate some of those things a little bit, and perhaps give you just a little bit more information. So first things first, washing your hands is one of the most important things to help prevent the spread and to prevent contracting coronavirus. When you're washing your hands, the recommendation is that you wash them for about 10 to 20 seconds with soap and water. If you look at the picture right at the top of the page there, you can see this is a lady who is washing her hands, and her hands are being put under UV light just to give us an understanding of how well she's handled. So this first picture here, number one, is before she washed her hands. The second picture is just using water only and rinsing and shaking. The third picture, she's using no soap, but she uses water for 6 seconds. In the fourth picture, she's using soap and water for 6 seconds. You can already see the vast difference in how clean her hands are becoming. But at the far right end of the picture, there is sort of the best level of cleaning your hands. That's 30 seconds with soap and water. Now, when you're washing your hands, there are areas that are very easily forgotten or very easily missed. And some of these things will explain to us why we still have transmission of COVID despite people doing the things that they need to be doing. Sometimes things just aren't being done quite right, but also, of course, sometimes there's just not much that you can do to prevent sort of transmission of the virus, the things that are outside of our control. But within washing your hands, if you look at the bottom picture there, these are the places that are easily forgotten when you're washing your hands. So your thumb, the tips of your fingers, and in between your hands. And because of that, you know, there's a technique that is called the ALIF technique that we use within hospitals. I'll just come out of sharing the screen just so I can show you what we do with the ALIF technique. So first of all, obviously you wet your hands with water, put some soap on them, rub them together. I don't know if you can see me well. Rub your hands together. Clean your thumb or wash your thumb. So use one hand to clean the thumb on the other hand, and then the same for the other hand. Wash in between your fingers, you know, in between the webs of your fingers. You need to wash the tips of your fingers like that. Okay, and wash the back of your fingers by doing that sort of movement. I hope you can see okay. And then wash your wrist at the end. And then after that, you rinse your hands with water to clean off all the soap. Once you've washed your hands for 30 seconds with soap and water, you need to make sure that they're thoroughly dry. You don't want to negate everything that you've done by moving away with wet hands and then touching something and all of a sudden they're contaminated again. So we need to do that, that procedure there with care and intention, and that will do it well. We'll go back onto the slides now. So after the hands, we move on to the next preventative measure, or actually still within hands. If you don't have access to soap and water, you can use alcohol gel on your hands. It's not as effective, but it is better than nothing. And within that, you need to make sure that the alcohol gel that you're using is between 60 and 95% concentration of alcohol. So just be careful when you're buying things over the counter, because some products were cosmetic products that were developed ages ago and were never meant to target a situation like this. So just make sure you buy hand gels that have the right concentration of alcohol in them to help fight coronavirus. After that, we'll move on to face. How we protect our faces is using medical masks or fabric masks. Now, medical masks or surgical masks are mainly worn by healthcare professionals within their workplace. We also advise that at-risk groups wear medical masks. So these are people that have health conditions, perhaps sort of quite severe lung pathologies, or that have poorly controlled diabetes, things like that, where you're at a higher risk. Cancer patient, would advise that they wear medical masks if they can. Obviously, you have to spend money to get these masks. So if you can't do that, then of course you can go for the alternative, which is the fabric masks. Now, the fabric masks, I know there's a lot of people that make things at home. Some people are using scarves, some people are using their t-shirts and things like that. But the best thing that is recommended by the World Health Organization is to have a fabric mask that is made of 3 layers. Now, the inner layer needs to be a hydrophilic material. That's something that is water absorbent, because when you're coughing out droplets, you don't want them to pass through the mask and out. So we want them to be absorbed by that inner layer within the mask, which is a hydrophilic material. So an example of that is cotton. The middle layer then acts as the fabric, and normally we would advise that you use a non-woven fabric for that particular purpose. And then the outer layer needs to be a hydrophobic material, so something that is water repellent. I can't remember now off the top of my head. I think polyester is an example of a hydrophobic material. So if you're going to make these at home, just check the type of material that you're using. Make sure you have 3 layers, and then you can use that to make your mask. How to store your mask. There's no point wearing your mask outside, coming back in, and then you just throw it on your bed or throw it in your kitchen or throw it wherever. You need to make sure that you're adequately and safely storing a mask that you have used, so that whatever viruses might be on the surface of that don't contaminate your home environment. So store those in a plastic bag if you're not about to wash them yet. If you're using medical or surgical masks, they're designed for single use. So after you've used it, just throw it away. How to wear a mask. I'll come back and cover this in a second. But when to wash your fabric mask, I would advise that you do this daily. So to be able to do this, you need to have at least 4 or 5 masks that you have in your possession. You wear one today, you wear another one the next day, you wear another one the third day, you wash them all. And obviously, if you can, wash them at a slightly higher temperature with good enough detergent to make sure that they're ready for you to wear again in the next session. So I'll just come off again this screen share so I can show you how to wear a surgical mask. So I've got an example here of a surgical mask. I think with the light that I have in here, you might not be able to see the color very well, but that's a blue surface. And then the other side is a white surface. At the top of the mask, you have a metal strip. So when you're wearing a mask, and this will apply to fabric masks as well, make sure that your mask is covering your nose, your mouth, and your chin. So with this one, the metal strip goes at the top. You wear it like that. You hook in the ear, and then you need to pinch the top to make sure that it's nice and secure. Wearing a mask like this does absolutely nothing for you and for the people that are around you. So just don't do it. Don't do this. It doesn't help. Neither does that. which I've seen before. Just be mindful, guys. There's no point having a mask if you're not going to wear it correctly. So please, please, please don't put your mask below your chin. Actually, it's quite dangerous if you think about it, because if you've been wearing this all day, walking around, and you've got virus particles on the outside of your mask, the minute you move that down, you're dislodging a lot of particles which are easily going to get into your own respiratory tract. So it's quite dangerous to do that. So as much as you can, avoid doing that. So we'll come back to the slides now. Okay, so there are different types of masks. And I remember in the first wave, this was a really big deal. People asking about which type of mask to wear, which one's the best one, where do you get them, and all of this. And things seem to have settled down a little bit on that front. But just to make you aware, there are different types of masks. They're what we call FFP masks or respirators. These are specialist masks that tend to be worn in environments where there are aerosol generating procedures being done. So my colleague here, Dr. Proud, works in ITU. This is an area where they're putting tubes down people's throats. You know, they're ventilating them, you know, with pressure. And so that tends to produce aerosols or air droplets, which then come out of the respiratory system into the air that we're breathing. So in those particular environments, it's very important for them to have special masks like the one you can see on your screen right now. That's an example of an N95 mask. But for everybody else who is doing procedures that are not aerosol generating, or that are just people that are just in the community, you don't necessarily need to be wearing a mask like this. These masks are fairly expensive when you compare them to the masks that we're wearing day to day. And also they need to have a good fit. So if the fit is not right, you might as well just not wear this particular mask at all. It's doing nothing more than a normal surgical mask. So for people who work in healthcare environments, you will already know this, depending on where you work, that you'll be provided with a mask that suits the environment that you're working. But if you're just out in the community, then I just want to reassure you that a normal medical or surgical mask is sufficient, or you can just wear the fabric mask, as long as that's appropriately made. That should be sufficient in the environment that you are. So moving on from masks, space. Space is very important. Try and keep a minimum of 1 meter away from the next person who's from outside of your own household. If you don't have a mask, or if you're unable, because there are people that are not able to wear masks because they have some severe disease or maybe claustrophobia or something like that. So people like that need to be at least 2 meters away from the next person. So you've got to be very mindful of space. And within that, obviously, come all the government regulations about not being able to go and visit your friends, not being able to go to school, certain workplaces being closed. And that's all very important to try and protect us from the virus. Within that, I just want to reiterate, because I've got quite a lot of friends, that I've seen on social media attending parties during this time. And I know this talk is particularly targeted at young people. May I take this opportunity to plead with all of you to please refrain from going for parties that are being done underground or whatever you're doing with your friends. As a young person, you might have a minor reaction to the virus, or you might not have any infection, sort of any symptoms at all. But you've got to be mindful of the fact that you're not completely isolated. You live with your parents, or you live with your grandparents, people who are elderly, who will be more vulnerable should you spread the disease to them. So just because you don't have symptoms, it doesn't mean that you don't have COVID. You can still pass on the virus to other people without exhibiting any symptoms yourself. So you've got to be very mindful and very careful. And I'm pleading with all of you, please. I don't want to see on my Instagram people having parties and discos and things. Please, just let's be mindful of that and keep our space. If you live in a household with someone who's got COVID or who's got symptoms that you think are related to COVID, then again, you can try and isolate within the household. And I'll give you a little bit more information about that in a bit. Open the windows as much as you can. So that will just allow air to circulate. And that applies mainly for people who are working in environments where there are other people from other households. So if you work in an office, for example, or for us, someone like me who works on a ward, if I can get the windows open, that's great, because then we get the air moving, and hopefully any droplets or any virus particles will just get out through the windows, and then sort of cause less risk to the people that are within that building. So we'll move on to what to do if you have COVID.
Before you do that, actually, I just wanted, Rutendo, sorry to interrupt. It's so important, I think, the hand washing that you mentioned. And I think a lot of us, we may take it for granted, or we don't take it seriously enough, or as serious as we need to. I mean, I work in ITU, and I think, well, I know from the first virus, from the time the first peak occurred until now, I've never tested positive, and I've never actually caught the virus. And it's not because I'm clever, it's the grace of God, but also because of the fact that I don't take it for granted that you need to wear your mask and you need to wash your hands. So it's one of the things that I actually make sure I do constantly. And you mentioned masks. I see a lot of people, when they take off their masks, they take it off by touching the front. The whole point of the mask is so that all the particles collect at the front. And if you touch that, then you've just defeated the whole purpose. And I've seen someone taking off their glasses with their mask, casually cleaning their glasses, and then put their glasses back on, and then they put the mask back on, And you're thinking, and they've got people around them. It's things like that if you don't take it seriously enough, it's no wonder we're getting cases left, right, center, and a lot of people are. And now the virus is mutated, and there's talks that the new strain may be more. It's definitely more infectious, but they mentioned it may be 30% more deadly than the last. And so, it's more important now than ever to take this precaution seriously and to just be meticulous about it. I mean, it's so easy to just fail at this, but that's why we need, especially us as young people, that's why we need to be the ones that just make sure you do it right and make sure you don't fail on this.
I don't know what you have seen, Koda, in your practice, but it also looks like in this second wave, there's a lot of younger people as well that are being infected.
Yes.
And the ones who are severely poorly are really not doing well. And I think it's important as well to mention that when you've had coronavirus, yes, you've got the acute phase of the illness. That, okay, you can get over that. But some people are unfortunate enough that they are having what they're now terming long COVID, where you have symptoms that are lasting beyond the acute illness. So in 3-4 months' time, people are still struggling with their breathing. In 3-4 months' time, people still haven't regained their sense of smell, and some people still can't taste food very well. Some people are still quite tired and lethargic. So the effects can be quite long-lasting. So really, prevention is better than cure by far. There's no better way to say this, that you're better off not having had COVID at all than having to try and deal with the problems that come with it once you've had it.
100%, 100%. Anyway, so Rutendo, what do we need to do if you catch COVID?
Okay, so I'll come back to my slides. Give me taking time. Okay, so what to do if you've got COVID? So we've talked about all the main ways in which we can try and prevent getting coronavirus, but sometimes really there are things that happen that are outside of our control, or some of us have conditions, pre-existing conditions, that there is nothing you can do to change. Some people have diabetes. There's nothing you can do about that, apart from, of course, controlling your diabetes. Some people have asthma. There's nothing you can do to withdraw that from your lungs or withdraw that from your body. So, some people, unfortunately, will end up having the virus, no matter how hard they try to, sort of protect themselves and reduce their risk. So let's say you do get COVID. What do you need to do? So first things first, there are 3 really important things that I would advise you guys to do within your household if you've got COVID. First thing is isolate. Second thing is, isolate. Third thing is isolate. I can't say this enough. You need to try and isolate yourself as much as physically possible. And that's isolating yourself from the people within your household. So this is really difficult for people who live with their families. But the best way to do this is to stay inside your own room. So if you've got your bedroom, you stay inside your bedroom for 14 days. If you need food and water, then you can enlist the help of your family members to try and get those, sort of things for you, leave them by your door, and then you can get your food and eat it. If you have to share the bathroom, then wait until everyone else is finished showering or whatever, and then you get in, you shower, make sure you clean up after yourself, sanitize the room, and then you come out and go back into your bedroom. Isolation is very, very important because we've had families, whole families that have been sort of affected by COVID. And sometimes, of course, you will do your very best and there's not much you can do about it, particularly if you have young children that are affected by COVID, or if you as the parent have COVID, but you still need to look after your kids. It can be a little bit tricky in situations like that. But wherever possible, the best thing is to isolate yourself for 14 days in your room. And other things that you can do if you have COVID, keep yourself well hydrated. And this is very, very important for people who have a high fever. If you have a fever, you're losing you're losing water from your skin. So you get dehydrated quite easily. So keep well hydrated. You will have a low appetite, or most people will have a poor appetite, but you try your best to maintain some nutritional intake so your body has enough energy to fight the virus. Now, you can, at this time, rules don't really apply. If you like cake, eat cake. If you like ice cream and that's all that you can tolerate, have ice cream, because you need that energy to be able to fight the infection. My family always give me grief about this, but I absolutely love paracetamol. I stand behind paracetamol 100%. I think it's one of the best drugs that have ever been created. It's helpful for fevers. It's helpful for pain. So if you have a high temperature and you're at home struggling with that, take some paracetamol. You can take it 4 times a day. And that will help to control the temperature. Paracetamol will bring your temperature down, but it will also help with the pain that you'll experience in association with COVID. So a lot of people complain of headaches. That's a very, very big symptom when it comes to COVID. And that headache is normally a frontal headache, i.e. across your forehead or coming down to your nose, which indicates sort of the area around your sinuses. So, take some paracetamol. That will certainly help. And keep
it's definitely one of my favorite drugs, I'll be honest. If you ask my wife, she'll tell you every time she tells me she's got something wrong with it. I'll ask her, have you tried some paracetamol? Right? Because it works. And if you take it properly, it does work. And by properly, I mean just take it every 4 to 6 hours, even if you don't have pain and even if you don't have a fever, because that builds the level of paracetamol in your blood. And so it prevents you needing to take it, and by the time you take it, it may take half an hour to an hour to work. Whereas if you've been taking it every 4 to 6, then you don't need to. Paracetamol, great drug.
Mom, Dad, I hope you heard that. Paracetamol works. Okay. So the other thing that you can do when you've got COVID and you're stuck in your room is keep your communication lines open. I know a lot of people say bad things about social media and how it eats into your time, makes you less productive and things. But in this particular situation, it becomes really, really useful having social media, having your phone, having access to people in the outside world, because it can get really lonely when you're self-isolating. That can play on your mood and your mental health. So one way to combat that is to keep your communication lines open with your friends. Text them, call them, video call them. You'll almost feel like you're in the same room. I mean, I have family outside of the UK, and to be honest, I've gone, sometimes for years without seeing my sisters, but it doesn't feel that way because I keep talking to them on video chats or on, whatever platform you guys use. So I would advise that you do that, because 14 days is really, really a long time. So you need to look after your mental health, look after your well-being, keep those communication lines open. What I will say is, if you find that you are struggling at home, please seek medical attention. Don't leave things too late to a point where you're really genuinely struggling with your breathing, or you're lying on the floor, sort of listless without any energy or anything like that. If you're starting to struggle with your symptoms, seek medical help. So here in the UK, I know we've got audience from Australia, we've got people watching from Zimbabwe, South Africa, Ireland. Thank you all so much for joining. I'm sorry I don't know how things work in your particular healthcare systems, but for the people here in the UK, if you are struggling with your symptoms, you can call 111 from home. You can call your GP, or you can call an ambulance, depending on the severity of your symptoms. And I'm sure that this sort of pattern is replicated in other countries where we have audience at the moment. I'm sure there are those facilities available for yourselves as well. Okay, I'll hand over to Proud to take us to the next part of the talk.
Yeah, so a lot of people wonder or ask, is there a cure? The simple answer is no. There isn't a cure for coronavirus, which is why we're stressing the importance of prevention and avoiding spreading of the infection without knowing. I think my motto in the first wave was, everybody has it. Anyone you come across as the coronavirus, until they're proven otherwise. So treat them like they do, but also treat yourself like you've got it too, because you just don't know. Now, what can you do before you get the virus? Now, these slides I'm going to share are not my own. It's important to say that. I've got references at the end, and there are trials ongoing. So some of the stuff I may mention may not be widely available. But there are some things that I think you can do to help yourself. So before you get the virus, and even in the early stages of the virus, I think it's important to boost your immune system. Because if I take you back to this slide here, you will see that after that 11 to 14 days, there's this immune dysregulation. What that means is your immune system starts fighting itself, okay? You get an inflammatory response phase where you then get all these, depending on how strong or how good your immune system is, that's what determines whether you survive that phase. I'll be blunt and say that. Now, we don't know what, I think in hospital they give things like steroids because they reduce that response. But I think and believe that before that, there's some new evidence that's coming out that says if you boost your immune system with simple things like multivitamins, you improve your immune system and you improve your chances of fighting the infection. I'm not going to say it will improve the outcome because we don't know. But things like vitamin D, vitamin C, and there's this quercetin, zinc, and melatonin just helps you with sleep at night. And you can find this on Google or online. But if you take multivitamins, whether you're high risk or not, but particularly if you are high risk, you've got diabetes, hypertension, other comorbidities like Uchenda was mentioning earlier, I think this will just put you in a better stead if you do catch the virus. If you think about what have you got to lose, really a few quid, maybe £10, they're not expensive, but the benefit may be more than you can appreciate. And moving on from that,
sorry,
sorry.
For a second, sorry. Just back on the multivitamins that you're talking about. They're not expensive in this country, but we do have people that are watching from other countries, and the situation might be different where you are. What I will say about vitamin D, for example, is that it is particularly a problem within colder countries like here in the UK. So here, I'll definitely advocate for people to take vitamin D. But if you're in a country like Zimbabwe, where we've got sunshine galore, I wouldn't bother with the vitamin D because you probably are okay on that side. So you can save your money in, because it's a difficult time for everyone. People are struggling with finances and things like that.
That's right.
And so if you're in Zimbabwe, for example, you can prioritize the other vitamins above vitamin D because you've got adequate sunshine to hopefully be okay on that side of things. So, yeah.
Yeah. I can see our stream is still live. It's not been taken down with that controversial advice I've given, which is great. So we shall move on to more controversial stuff. Okay. And another disclaimer: none of these slides are mine. I've got references at the end, and we're just going to talk about vaccines. Okay. There's been a lot in the media, so we'll quickly talk about how they work. So vaccines, we know they work they stimulate the body to produce antibodies, and these antibodies stay in your body until the next time, say in the future, if you are then exposed to that virus again, you can fight it quicker and therefore prevent a more serious infection. That's why they want and they advocate for them. How do they work? Now, there's two main vaccines in this country. You've got the Oxford and the Pfizer vaccine. Both work by stimulating the immune system to create antibodies against a spike protein on the coronavirus. Now, the coronavirus itself, we know the corona stands for crown in Latin, and so that's where it derives its name from. This crown is a spike. It's like a spike protein on the surface of the virus. And so to stimulate an immune response, the protein needs to be recreated inside the human cell. And the way the viruses do this differ, but essentially that's what they're trying to achieve. The Pfizer BioNTech vaccine is manufactured from plant-based cells, similar method of action to the Oxford one. It uses a messenger RNA, which is a piece of genetic material that transfers DNA into the cell. So the mRNA itself doesn't enter your nucleus, it just transfers some genetic material. And with this genetic material, normally it's an instruction. It's like it's like an instruction for the cell to then produce antibodies. So the spike protein triggers an immune response, and then you produce antibodies. And then the next time you're in contact with coronavirus, you've already got these antibodies in your circulating in your blood, and you can detect the virus quicker. You can fight the virus quicker, and thereby you don't get as serious an infection. Now, like anything, even paracetamol has side effects, okay? There's many side effects. There's common side effects. There's less common side effects. The most serious side effects are not that common. Severe allergic reaction like anaphylaxis, which is really just unfortunate for anybody because no one could ever have known that that was going to happen. The less common side effects are pains, feeling tired, kind of feeling like you've got coronavirus, but actually the vaccine does not introduce a live coronavirus into your body. And then what do they contain? Maybe not hundreds, loads of things. I won't name all of them because the majority you don't need to know. I can tell you what they don't contain, and it's a microchip. They do not contain, there's no evidence anywhere that they've got a microchip in them. There have been rumors circulating that, they contain a radio frequency identification device. Nanoparticles. Now, I've received the vaccine myself last Monday, and the syringe they use is smaller than my pen. They give 0.35 mils of the vaccine through a 1 mil syringe, and it's so small. Even the needle is so tiny that you couldn't possibly fit anything through that. So anyway, it contains a GPS tracking device. You would need a power supply for that, so it wouldn't be possible to inject. Or it contains a chip that is a mark of the beast. Oh dear. Um, all I can tell you is there's no evidence. I mean, I don't make the vaccine, so I can't tell you that.
Yeah.
But there's no evidence that there's a microchip in it. I've got nothing to benefit from saying any of this. I don't work for the drug companies. Disclaimer again. Anyway, let's move on. What about the rest of the ingredients? Same things that you find in most vaccines. It just helps the vaccine stay stable so that it lasts longer. I mean, in terms of the vaccine itself, would I recommend it? I guess that's the main question. Like anything, I think and believe it's individual choice. Now, we may get shut down for what I'm about to say, okay? It's individual choice, okay? Now, for me, I'm a family man. I've got a wife and I'm a new dad of 6 weeks. I'm a 6-week-old dad. And the benefits of not getting coronavirus would simply and by far outweigh any of the bad things or that could happen to me. And so for me, it was a no-brainer, okay? My mother is also a diabetic, and I like to see my mother from time to time, often actually. And so, you know.
Be careful, I'm sure she's watching.
Yeah, it's true. So, you know, I like to do my part to make sure that the people around me stay safe, okay? Because I would never want to put that, or I wouldn't want it on me if something happened to them because I was just careless. And that's why I'm meticulous, and that's why I'm so. Anyway, what about the rest of the ingredients?
Sorry,
so
can I just say something real quick about the vaccine? Sorry, first of all, I can proudly say I had the vaccine 2-3 weeks ago, and I haven't grown a tail or a sixth toe, so it's okay, guys. I'm all right. It's safe. Talking about the vaccine, sorry, Krida, I've just noticed now that we have 1 million questions on the comments, and I do apologize, guys, that we haven't been looking at these. We've just got so engrossed in.
I've been looking at them.
But one of the things that has just been asked is, what are antibodies? Because you're talking about the vaccine and how it helps us to create antibodies. But what are antibodies for those people that don't know?
Okay, so antibodies it's a protein in your body. There's different types of antibody, and they are given letters like A, G, M, as in IgG, IgM. They are proteins in your body that help you fight infection. So say, for example, you get exposed to coronavirus and you go through the illness. The body has cells that produce these special proteins that can detect the virus the next time you're exposed again. So these antibodies circulate in the body, in your body, just waiting for this virus to turn up again. And then as soon as the virus turns up, they detect it, they fight it. And, you know, initially we talked about this 1 to 5 days initial incubation period for the virus to replicate, to divide, and all of this. When you've got antibodies, you go immediately into fighting the virus. And that's why they work, and that's how they work. So what was the other question, sorry?
I think that was the main one for now.
Yeah. So the vaccines, there's different type of vaccines. Some will give you the actual cold, like the common cold, the cold and flu vaccine gives you a milder form of the actual disease so that you create antibodies. And then your body can recognize the infection when you see it again. Whereas with these vaccines, it's a newer type of vaccination, which just stimulates your cells via this messenger RNA by giving it genetic material. And genetic material then causes your proteins to create the antibodies. So they just work slightly differently, but they do essentially the same thing. Now,
on that note, I know a lot of people are concerned about the fact that they're getting genetic material in a vaccine. And I just thought maybe we should reassure people that, you know, what's going around in the media is not particularly true about, oh, this, you know, sort of genetic material then integrates into your own DNA and you become, you know, like some altered human sort of state. It doesn't work like that. You know, once you have that bit of genetic material put into your body recognizes that. Your cells start transcribing protein based on the messenger RNA that it has received. It's that messenger RNA that produces the protein. The protein then, you know, sort of causes the immune system to react. But the bit of genetic material that's in your body only lasts about 4 to 5 days, and then it is degraded and it becomes null and void. It does not integrate into your own genetic material. It just it's not scientifically true. And so be careful about the things that you're listening to in the media. People have different motives behind the things that they say. Some of these motives are financial. Some of them are just to incite some sort of hoo-ha in the world, you know. So just be careful about the things that you listen to and the things that you take on board.
And just to add on to that, I think one of the questions we received was, are you protected after the first dose? The answer is possibly not, okay? Because of the fact that the DNA material, it's lost as soon as the cell divides, okay? So that can be from 7 to 42 days. And so that's why you need a second dose of the vaccine. And the dosing times differ. I think it's 4 to 12 weeks for the AstraZeneca Oxford vaccine, and it's about 3 weeks for the Pfizer vaccine. And so you need to receive both doses to be fully immune to the virus. And I think the other question on the chat was, are you protected from the new strain of the virus? And the honest answer to that is, I don't know. We don't know. Maybe, maybe no. It's difficult to know because they would need to run further trials and tests and all of that just to be sure.
Sorry, can I just add on to that bit about, are you protected after the first vaccine? So it's not that you have no protection whatsoever. Even just receiving one dose of the vaccine will build up some immunity in your body. Of course, the desired effect is after 2 doses, but it doesn't mean that after one vaccine, there's absolutely nothing that's happened in your body. There will be a reaction, there will be an immune response, but that needs to be sort of boosted by a second dose. So,
yeah. Any other questions? So what shall we do? Shall we touch on the other questions that were asked?
I think we finish off the presentation, because we're coming up to an hour. Maybe we can finish off the presentation and then we can jump into the questions. There's loads of questions.
Okay, so I'll share my slides. I think the next main bit was, we understand that this has been difficult for a lot of people, okay? And we've been affected by, you know, it's been a hectic year, to say the least. We've lost a lot of people, and even me working so closely with coronavirus, most of the patients, you know, they spend maybe 2-3 weeks, maybe longer, in ITU, and unfortunately, most of these you lose, and it affects us. We're human, and I think that the other thing that we felt we would like to touch on is the fact that there is support for anybody that has been affected by coronavirus or by loss due to coronavirus. And Richard, can you just add on to this?
Okay. So first of all, you know, the losses are wide-ranging when it comes to COVID. So some people have lost their jobs, for example. That's a loss in itself. Some people have lost social contacts, their friends and things like that. But some people, going beyond that, have lost family members. So, you know, some people have lost fathers, mothers, sisters, brothers, whatever. And, you know, it's very difficult. It's very challenging. Some people work. We've lost patience. We're human. It does affect us, and unfortunately, we're seeing this daily. Every single day there is sort of death around us, and it can get quite overwhelming and stressful, painful for people. So my advice would be to stay connected as much as you can. Speak to people around you. Have a social network, your friends and your families. They can support you with the emotions and the feelings that you'll be experiencing. Outside of that, for people of faith, of course, you've got your faith leaders, your pastors or your youth leaders or your church leadership or whatever structure that might be. There's always somebody who is ready to listen. And you shouldn't look at yourself as a burden, because that's one hindrance to people looking for help. There are always people with open arms who are ready to give you a hug or to listen, a shoulder to cry on. But if you're struggling with your emotions, perhaps that's sort of low mood or depression or whatever it is that you might be experiencing, you can reach out to your GP. They can signpost you to bereavement counselors. They can signpost you to just normal counseling and help. But if you desperately need so, then there are medications that can be used to, temporarily, short term, to try and help you with mood and things. So don't suffer in silence. Don't suffer alone. Reach out to somebody. Even if it's me and I don't know you, I'm more than happy to, sort of to help and to try and signpost you to, keep you of assistance to you in this time.
Lovely. Don't suffer in silence, guys. And the main thing is, after it's all said and done, I mean, me and Rutendo, we are believers and we are Christians. Above all else, we believe in God, and our hope and our trust remains in God. And through this all, I know I myself have prayed for some of my patients when I felt there was nothing else I could do. Not loudly, just in my heart, because you may get arrested for those kind of things. But yeah, I've just done it in my heart, because I believe, you get to a point where there really isn't much else you can do. And it's a very, very, very difficult place to be when your single job and role is, to alleviate pain and suffering and to help people. And with all the machines that ITU has, we can get to a point where there's not much else we can do. So for me, I pray, and at the very least, it makes me feel better that I've done everything I can. And now, finally, sorry, did you want to add?
Within that, because like you say, first and foremost, we are children of God before we are doctors. I think it's also just a recognition that our God is a God of seasons. We go through different seasons in life, and unfortunately, this is one of those harsher, more difficult seasons that we're going through as a race, as a human race. But it shall pass. This too shall pass. But whether we lose people or not, whether we catch COVID or not, whether we end up in hospital or not, God remains God. And within that, we need to keep our eyes focused on Him, our trust on Him. And I hope you guys have found this talk useful.
Yes. Now, we're just going to touch on the questions, and I want to start with the comments on YouTube. Thank you guys for all the comments and for watching, and for bearing with us. We've never done this before. This is the first. So you've been a great audience. Now, some of the questions were, I'd like to thank Melody Maruta. I think she's given us some numbers on after the first dose, you get 75 to 78% immunity 14 days after the AstraZeneca, and then 93% after the second dose. Thank you for enlightening us. That's very, very helpful. What else was there? So, Rutendo, are these vaccines linked to Bill Gates in any way? And is it true that COVID is linked to 5G?
do you know, you know, I don't know, like, I don't even know where to start from. Like, I just cannot in my
These are
mind.
genuine. I can understand. These are genuine questions because I've heard about this. I've heard in the media about Bill Gates. It's guys, don't believe everything you hear and don't believe everything you read. Please, I could not stress that enough.
Yeah, but what I will say is this is not the first coronavirus that the world has known about. I will tell you the truth. When I first heard the news about coronavirus, because I worked in respiratory for 4 months as part of my rotations as a junior doctor, and within that we would get a viral screen done on patients, and part of that was coronavirus, and it was always positive. And when it's positive, it's like, oh, I'll send them home, it's nothing. Oh, I'll send them home, it's nothing. Because this is not the first coronavirus we've seen, and the previous ones we've known were the common cold. They were nothing to worry about. So the idea that this coronavirus might come from 5G, I don't know. I can't seem to process it in my head. I don't know. I can't see how. Perhaps if people have information on how that's possible, they can educate me. But it's not something that I know to be true. Coronavirus has been around for ages. This is just a different type of coronavirus, but we have experienced coronavirus before. So it's nothing overly new. It's just, you know, a different strain of viruses that we've known of before. So
and to add on to that, actually, regarding vaccines as well, it's important to know that, you know, in this day and age, we now have Instagram, Facebook, social media, very easily accessible, and one person can just send something to the whole world. Imagine in 1796 when the first successful vaccination against smallpox was developed, right? And, you know, if somebody back then had posted saying, oh, if you get the smallpox vaccine, you grow wings and the devil, you become, it's a mark of the beast or whatever, would we have eradicated smallpox? No, we would not have. It's simple as, we haven't had smallpox since 1980. And that is why. It's because
vaccination program.
It's because of the vaccination program, and it's because it works. And because it works, I think it was a lot more difficult to pass or to share incorrect information back then. And that's why it's not like people were not fighting it. I mean, even the MMR vaccine, we heard, oh, it causes autism. This is quite recent now. But you know, even polio. Think about polio in 1955 and 61. You know, the polio virus paralyzed thousands, and some people needed ventilation for life. There's one person. There's a polio victim who's been on a ventilator in America. What's called an iron lung. And you know, if everyone in those times had sent all this negative feedback or information about it, we would still be struggling with these things today. So that's my view on vaccinations.
There's a question here saying, can you get COVID twice? And the simple answer to that is yes, you can.
Yes, I've seen it.
I've seen cases for sure.
Yeah.
That have had COVID twice. So unfortunately, it's not great news, but that is the truth. How should we do?
Let me ask one of the questions that we received beforehand. So it is one covered after the first dose. We've covered that.
So hi, Proud. Hi, our two doctors. So sorry to butt in, but I've collected a lot of questions from the comments. Maybe just
lovely.
Great.
Just to make it easier for you to just
try
and answer as many people as possible.
Okay.
What I wanted us to do, maybe, I think, to be fair to everybody who kind of sent questions beforehand, we had a form that a few people did ask questions for. As Proud flashes his contact details and return those there, I guess you guys can follow them on Instagram and LinkedIn, Facebook, just in case you need to ask them maybe a personal question. So I'm just going to
say hello.
Yeah, I was just say hello, please, and make sure to follow the MK Phoenix Instagram as well.
Of course.
So let's just go through the spreadsheet first, and some of the questions that came in first. So, for young people, I think this is a very important question. I'm worried about my parents. They don't believe that they should get vaccinated because of stuff that they've been receiving from word of mouth and WhatsApp. I've tried talking to them, but our generation gap is making things difficult to have an honest discussion. What should I do?
Over to you, Rutendo.
I think this is a very, very difficult question, and it's a very difficult scenario to deal with. What I would say is, we need more of these talks, right? We need more of these talks, not only for young people, but also for the more mature people within our churches and within our communities. I think how we can help in situations like that is to have more of these platforms where we can, educate people, bring them the evidence, you bring us your questions, and we can try and deal with them as best as we can. So I think that's probably my suggestion, that within our associations, whatever structures we're in, we need to come up with platforms where people can talk and express their concerns and hopefully get their questions answered. So that's probably the best that I can suggest. I don't know if you have
No, I agree. I hope they're watching, because you've talked a lot.
Yeah, it was an anonymous viewer.
Yeah, no, I know. But parents, I hope you're watching. And before you refuse or before you make up your mind, just research and don't believe things that come from whoever you follow on Facebook or YouTube. I mean, I could go as far as saying, don't just believe anything I tell you, because even that could be wrong. Just do your own research and make up your mind. That's the point. That's
very, very careful about social media. There is just so much going around in different circles. I hear that in the past week or so, within the Muslim community, there were concerns that perhaps there's alcohol in the vaccines, and therefore people are, all like, because Muslims and alcohol don't see face to face. But my point is, in every social circle, whatever there'll be people with concerns that are linked to your belief system. Within Christianity, within Muslim, within Jewish people, within the Hindu, they'll have their own concerns that are, related to what they believe. Just be careful what you listen to. Be careful what you take on board. Like Kuda said, just do your research, speak to people, authorities in the field, and then you can make your decision that way.
Yeah. So I think all three of us have been youth leaders at some point. One thing I would say, because I think that question did come from a young person, what I would say, if you are finding it difficult to communicate, maybe within the house or with your parents, your guardians, or whoever, do seek out your youth leaders. If it means you need to contact somebody at school, maybe just to help you be able to talk to your parents and have an understanding, or if you're concerned about them or you're concerned about yourself, just make sure you do reach out to somebody. Like these guys were saying, do not suffer in silence. I think that there is a little video that's going around with the Zimbabwean president saying, it doesn't care whether you're rich, it doesn't care whether you're poor, it doesn't care whether you're sad or happy or whatever. It will get you if obviously you're not vigilant. So what I will do is just try and move on so we can sort of go through as many as we can. Is it true that Black or Asian minorities are more susceptible? And also in hospitals, is it true that there is a larger majority which are Black or Asian people, particularly for you, Proud, maybe in ITU? Do you find there's more ethnic minorities in there?
I think yes is the simple answer. Why? I don't think we really know. Yes, there seems to be a disproportionate predisposition. ITU I think in the first wave, we did have a lot of Black and ethnic minorities. Again, I don't think we ever managed to get to the bottom of why that was. Whether it's genetic, because if you think about the conditions or the comorbidities that make them higher risk, like diabetes, like high blood pressure, we tend to see them more commonly in Black and ethnic minorities. Whether, and obviously these conditions weaken your immune system, so whether that it's that, what I know for sure, things like weight, so being obese or overweight, that definitely does affect or increases your chances of, or reduces your chance of fighting the virus. Yeah, so I think that's all I can say. What do you think? What do you think, Lieutenant?
Yeah, I think that particularly here in the UK, like you're saying, there's disproportionately more Black and Asian minorities that are contracting the illness and perhaps suffering a bit more from it. I think a large proportion of that risk is socio-economic. Unfortunately, well, I don't know if it's fortunate or unfortunate, a lot of us have roles that put us in the front line. You know, we have a lot of Zimbabwean nurses, a lot. I work with a lot of Zimbabwean nurses. A lot of Zimbabwean healthcare assistants. In radiotherapy, I've seen Zimbabweans there, Nigerians. There's a lot of Africans that are within roles that naturally put them at the forefront.
The highest proportion is from those countries, yeah. The highest proportion.
So I think yes, we might have some comorbidities that put us at risk. But actually, even those comorbidities are a result of socioeconomic factors. So it's where you work, what job you do, how much money you earn, what community you live in, you know, your day-to-day activities, your exercise, all of those socioeconomic things will determine the health problems that you then have. And then those health problems then, determine the risk that you have of, so how badly you'll suffer from COVID. So yeah, unfortunately, we have that in our community. The other thing I will mention is that particularly amongst the Zimbabwean nurses, I know a lot of them work as agency nurses, and that's great because you can make a little bit more money, you're a bit more flexible, which is fine. But the unfortunate thing is sometimes you then end up in a situation where you're put on shift in a ward that you didn't know, or you weren't overly prepared that there is COVID on that ward, or particularly in mental health. I know some of my friends that work within mental health, they've been put on one-to-one observations with particular patients. These sorts of things happen. So I think without trying to be too political and too Black Lives Matter about this, there are socioeconomic factors that do mean that sort of Black and Asian minorities are at more risk. That's me.
So guys, I don't know whether this was a question or not, but there's a lot of questions relating to the same topic. I think we've got Anna Zira Vunzawabaya asking a lot of people within our African society are considering using herbs to steam and to have Vicks. Now, personally myself, I have had COVID myself, and I've recovered successfully. I was at home, I isolated, and I did everything that I had to do. But one of the big things is that from a lot of people, my own family and other people, they would say, use eucalyptus oil or steam. Just, I don't know, do those kind of things, or eat this seed, it'll help your immune system, that sort of thing. What's your opinion on that sort of thing? Are those things helpful in terms of, particularly I think steaming and using things like Vicks just to help you with your breathing and whatever else?
Yeah, so I think, the first thing to bear in mind is that if it doesn't do any harm, then why not try it? Yeah. Because at the end of the day, that might be the thing that saves you. But also, after the first initial period, you can get a bacterial infection on top of that. Okay, you can get secretions, so thick mucus secretions in your lungs, which are very difficult to shift.
Yeah.
And a lot of people get these block off some of your airways and prevent you from breathing properly. So you then get hypoxia, your oxygen saturation drop, and you know, a lot of people may never know that this is what's happened. So things like steaming is good for that sort of thing. We in a way, I guess we steam in ITU because we do a lot of nebulizers, which no, it's true,
Yeah.
isn't it?
Yeah,
We do a lot
absolutely.
of these things that, you know, it's medical and it's given these medical terms, but how it works is essentially the same. Okay, so what it is, it's introduce very, very tiny particles into the lower airways so that they can, all these thick mucus plugs, they can dissolve and just become loose enough for you to be able to cough it up, and you don't then get a part of the lung that collapses because this is there. So, you know, steaming is the same thing, I guess. It introduces steam, water into your lower airways. Loosens. Yeah, exactly. We do all of this in ITU, humidification. We just do it in a different type of way. And, you know, even the humidification, it's temperature controlled. So it's heated humidification. So you give water and you give heat. And then we do a lot of chest physio. This is another thing that helps patients in ITU, because we know if you get rid of these secretions, if you improve their breathing, then they don't get this superimposed bacterial infection. And, you know, I guess with Vicks, what does Vicks do? I don't know what Vicks does. Maybe yeah, I can't think of it. I don't know. I'm sure I know it works. I just can't think of how.
That's great. So guys, what I'm going to do, I think I'm just going to sort of wrap it up. We'll just do just a couple more questions, and then maybe
before you go on, just really quickly, for people who take medication already, be very careful about herbal treatments, because some herbal treatments will come and inactivate the tablets for your diabetes or the tablets for your, you know, heart rhythm or whatever. So be careful if you're already taking other medicines. Just be sure that the herbs are not interacting with that.
Yeah. So we'll just do a couple more questions, and I think definitely this has probably earned a part 2, because I think on all our platforms we've got well over 100 people watching. So maybe we might need to just do a part 2 and try and have answer more questions, because I know a lot of people are going to have more questions about this, and then maybe after we've done that, I'll just leave maybe both of you to just maybe have your final statements, and then we'll bring everything to a close. So I've got Phyllis Joa here, who said she's had the Pfizer vaccine on Friday and was booked to have a second one on the 14th of the month. I know you guys did mention that you need to really have both of them for it to be super effective, but obviously you are protected somewhat, yes, even with the one dose. Something that I do encourage everybody to do is maybe watch all the briefings that the Prime Minister does with his team, and they at least explain to you. So one of the questions that came up, I think it was on Friday, was a reporter said to the chief doctor, "You said there should be a short time between the 2 doses, but what you're doing is that you're now increasing that time." And obviously his answer was, it's better to have more people having the first dose than to have more people not having the dose at all. So I don't know what your opinion, guys, is on that. You know, because I really want people to feel comfortable just having the first dose at the very least. If they are choosing to have the vaccine, can you just maybe settle people's nerves in terms of the length between the doses?
Okay. So obviously Pfizer would have done their own research and have their own protocol on how the vaccine should be delivered. And the truth of the matter is, their suggestions are ideal. You know, in an ideal world, this is how we would do it. But at the moment, I think faced with a pandemic, where everybody is at risk. I think on a population scale, you've got to look at what works best for the population. And in a way, if you have everybody at 50, let's just say everybody is at 50% immunity, all of a sudden you've got a herd immunity in your population, rather than having 10% with 100% immunity and then the other 90, are at zero. You have, at a population scale, it's better for you to have everybody at 50 than 10 people at 100, because all of a sudden you're protecting the whole population then, and the bouncing around of the virus is then dampened down. So you have less ill people, less need for hospital admissions, less need for this, that, and the other. On an individual level, of course, it's better for you to have it, as prescribed. But I think on a population level, it probably makes sense to split those viruses, those vaccines a little bit further apart, just so we can get, herd immunity within the population.
Yeah, that's absolutely great.
I agree.
Yeah. So just last but not least, I guess for us primarily, we did do this for the young people, and we don't want them to get lost inside this bigger conversation, but they need to know all the information that you guys have shared. I guess maybe as your last remarks, what is your advice to young people who are going through this, particularly I know that we're speaking from a medical point of view, but I would also like you maybe to just touch on the fact that you're now home, you can't go anywhere. We've said isolate, stay at home, and some are locked in their rooms, and obviously the usual pattern of life for them has been disturbed. What would be your advice to them at this time as doctors, since you sometimes do deal with young people in the hospitals?
Go on, Jen.
That's a hard one. I think for the young people, I guess my closing remarks would be, obviously, you've got parents, you've got older people within your family. Do your best to protect them by being sensible about the things that you do. But also, I think that this COVID period brings a unique opportunity to develop yourself in a very different way. Like, I know a lot of people within this particular time have learned how to trade. There are young people who are making good money trading. Don't waste your time. Like, don't be on Instagram 24/7. Don't be on YouTube, the beats, playing or whatever. There's so much you can do to develop yourself as an individual. There's a lot of learning you can do online. Obviously, you've got your own learning from school, and you've got lessons and things like that. But if I had experienced lockdown in the way that everybody has, because obviously I've had to go to work every day, my life hasn't changed drastically. But had I been given that opportunity, honestly, I would have learned how to trade. I would be trading stocks or shares or whatever on the stock market. I would be learning how to play a new instrument. I would be learning a new language. There is a lot that you can do at home. People have learned coding. You can do an online, course on coding. All of a sudden, by the time you come out of the lockdown period, you have a new set of skills which makes you very employable and can make you good money. So don't waste this time. You can't be at home sitting around watching Netflix, saying you have nothing better to do. Oh, I'm bored. I can get that, obviously. You want your social interactions, you want your friends around, but why not use this time to develop yourself? Come out stronger and better and unrecognizable. There are people who are going to come out of this lockdown having made loads of money. I know I'm talking about money. It's not all about that. There's so many things that you can do to develop yourself as a person. But what I want to emphasize is that just because you're at home in your room doesn't mean the world has stopped. World has stopped going around, or the stock trade has stopped, or whatever. There is so much that you can do with your time to develop yourself as an individual. And better the other side.
Now, that's absolutely brilliant, guys.
I'll just add on to that very quickly. I think as a young person, the most valuable asset you have is time, okay? The one thing that a 90-year-old probably regrets about the most is not having used their time more wisely. Okay, and being young and being in this generation and environment we're in, you could do so much with your time. How do you think Facebook and YouTube and Snapchat, Instagram make money? It's through your time. So you're selling your time in exchange for them making money, because then they have to advertise, and that's how they make their money. But by advertising, obviously you have to be watching it and looking at it all day or however long you do. And so by simply scrolling through, they're making millions, and they're sitting in their houses. And what's going on with your life? Probably you're just sitting there, screen time going up. And your most powerful asset is your mind. Okay, and don't just sit on it. Just you could be creative. You could, like Ruben was saying, there's so much you can do. Just pick up a new skill or a new hobby. And some of these things, like investing in stocks, like we were saying, it's one of those things that you may not see the benefits today now, but in the long run, you will thank your future self for it. So stay safe, guys.
Sorry, I said this is the last thing I was going to say, but another thing I guess that you could do with your time is to be kind. You know, there are people out there who are suffering. I've got friends that have lost loved ones. Drop them a line, you know, call them, just check up on somebody else, show them some love, some concern, and people will definitely appreciate that. It's a very difficult time for a lot of people. So don't be isolated socially. Keep in contact with people, show them some love, reach out to them, whatever platform you can do that on.
So, guys, just before I wrap up, thank you once again. I know I've just got one more person who's been very insistent in the chat. We'll do that one, and then that's the final question. We are definitely, for everybody who's watching on Facebook, on YouTube, we're definitely going to do a part 2. There were so many questions that there's just no way we can cover them in one session. So we definitely will partner up, not only with Dr. Proud and Dr. Rue, but we'll find other voices as well that can come in from within our community, the professionals that can speak to some of these questions that you guys are asking. So I've got Faithful Baller who asked, if I can paraphrase the question, I guess, he got the vaccine. Should I wait to go out, or can I just go out?
Well, so the person who's asking has had the vaccine, and they're asking if they should now go out.
I believe that's exactly what they're saying here.
Guys,
I got the first dose, so I got the first one. Should I wait to go out, or
I would follow government advice on these things, because even with sorry.
Yeah, no, sorry. Go ahead.
Even after the first vaccine, there is still a chance you could pass it on to other people. Okay, and poor old Betty is 87, and she's enjoying a pension, and she decides to go for a walk because she doesn't want to break a hip or to get bored in the house because she's alone 24/7. And then she runs into you because you've decided to go out, and you pass it to her, and Betty now is dead. It's a bit drastic, yes, but just think you're not really doing it for you, right? You're just doing it to be kind, like Rutendo said. Be kind, and let's just look after one another. That's the most important thing.
Thank you again, guys, so much for today.
Thank you so much for having us, sir.
It's been such a brilliant session. Like, it completely just blew my mind. I think I've myself probably learned a lot more, because I think even prior me having COVID, I think there were a lot of things that I was more ignorant about. It was information that was readily available for me, but I think sometimes, with our community, sometimes we don't go actively out to seek out that information and to protect ourselves. Like, things so simple as washing your hands.
Absolutely.
I definitely, I've had, I definitely have had moments where maybe I've gone to my garage and I've gotten something, or I've just gone to my car, because normally if your car's parked outside, you don't know. Maybe someone walked by and touched your car. I've just gotten back in the house and then just continued doing what I'm doing. But now I definitely am washing my hands all the time. And thank you for Rue, for showing us exactly how to do those things, even with the mask. I mean, Prad, you really got me. And I know people do it. I've seen them. People at work do it all the time. You clean it with the mask. So
that was no exaggeration. I saw
yeah.
that on TV. I saw it on TV.
Yeah, so that's absolutely brilliant. I just wanted to maybe speak to some people who did ask questions. I know there were questions that were more directed at our church, directed maybe at all the faith leaders. I think maybe on the next session that we do, we'll try and definitely have our professionals, but I think we do need to have someone maybe from the faith side as well to speak, so that everything is represented. Maybe some mental health people can come in as well and have maybe a more holistic session, I guess, because there were some questions. They're gray areas. I wouldn't want us youth leaders tackling them. So please, guys, allow me to protect you. But we have taken note of them, and definitely I will be passing them on so that they can definitely be answered. But again, guys, thank you so much in the live chats. You guys were absolutely on fire in the live chats. Thank you for taking part, and please make sure, Proud, if you can bring up maybe your contact details again with yours and Rue's. I'll just put them up on the screen there for everybody who wants to maybe get in contact with them. Proud has put his LinkedIn in there. He's also put his Instagram, which is Proud. I'm not gonna try say that word. And Rotendo has put her Facebook and her Instagram as well. Guys, please do make sure, again, with the MK Phoenix Project, please follow us on Instagram. We're also on Facebook. You can also find most of our stuff on the Ebenezer Fellowship channel, so our Facebook page or our YouTube channel. Would love to just have a conversation with you and talk to you, and especially if you're young and there's something that you just couldn't do on a public couldn't share on a public space, please inbox me. My Facebook is Mwarianesu, or you can contact me via our Instagram pages. I'll definitely be looking out for those. If you just need to have a private conversation, we're definitely there to talk to you, and I'll lead you definitely to the right places if that is the case. But it is with that, guys. Thank you so much. Please, in the comments, thank my guests. I appreciate you. Just to say, guys, I don't work alone with the Phoenix Project. I work with a massive team. I would love to mention all of you. Well, my pastor, Pastor Manyanga, and Minister Winnie, thank you guys so much for empowering us to be able to do these kind of stuff. I just want to thank my wife, Yana. She's always there. Dr. Proud and Talent, you guys are always there to give your opinions and your input. Laina Karinga, Tatenda, Tsungirai, guys, Menashe, and all the rest of the team. And one giant I can never forget, Mr. and Mrs. K, the Calusas. You guys are my rock. You guys always give me advice on how to run things and how to do things in the proper way. Thank you again so much. One of our other people that helps us with the project, Deacon Machipisa, again, I appreciate your help. We couldn't have done the project without you backing us on this as well. So if I've left anyone out, please, 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 please forgive me. But I know that my thanks is received. So it is with that I say goodbye. Goodbye. Take care. Have a good night. Cheers. Bye.
Bye, everyone.
Bye.
Bye.
Shock made this one.